Amazing. So if someone's talking next to you, say, shh. Did you hear what Patrice is saying to the audience? So I just need everyone that's a part of this forum. We're gonna kick off in about 2 moments. We have our wonderful panelists here this afternoon. So we're gonna ask everyone, if you don't mind, maybe move 2 rows up, just to kind of, get a little closer. Don't be shy. It's all right. I forgot what commercial that was, but it worked. So we are excited to host this forum here at the House of Justice during our Women's History Month. We want to thank our chairwoman, none other than Ms. Kathy Jordan Sharpton, for being in the building and for making sure that important forums like this happen throughout the month of March. And again, if we're having side conversations, we're going to ask you to take that outside. We want to respect our panelists, respect everyone's time. They are here, they're ready, they're in their uniforms, and we're excited about it. I also want to give a shout out to our Women Auxiliary President, none other than Lisa Goldie Harts, and all of our sisters from the Women Auxiliary here at the National Action Network. If you can stand where you are so we can show you some love also. Please stand. Thank you, thank you, thank you. So if it's okay from you, Madam President, we're going to kick it off. So this afternoon, I'm going to need, thank you so kindly. This afternoon, and each Saturday here at the National Action Network, throughout the month of March, the Women Auxiliary, we're doing amazing forums. Last week, we discussed mental health, which was very important. This week, we have a great team, a medical team, that we're going to talk to, hear from, learn from. And it is my honor to introduce our panelists for today. I'm going to introduce them, and then we will go down the line. They will talk to you and tell you just a little bit about themselves individually. We are honored who will be our main speaker today, and she is from the Columbia University Irving Medical Center, none other than the Reverend Dr. Gail Badger. She's also a minister. Yes, thank you. She's also a minister from the Mount Zion Baptist Church. And joining her today is community health leaders. And we're honored to have Ms. Paula Stevenson and Ms. Michelle Franklin. So, again, we welcome you here to the House of Justice. We're thankful that you took the time out to educate our community. We're going to go down the line, tell the crowd about yourselves, and we're going to kick it off. So we can start with the Reverend Dr. Gail Badger, and then we can move down to Ms. Michelle and Ms. Paula. Everyone, I present to you our speaker of the day, Reverend Dr. Gail Badger.
Y'all don't mind if I get close. My name is Reverend Dr. Gail Badger, as the young lady said. I'm from the New Mount Zion Baptist Church, where the Reverend Dr. Carl L. Washington Jr. is my pastor.
My man.
Yeah, your man. But today, in this capacity, I have on my community health worker hat. Technically, my background is in affordable housing. I've been in affordable housing for about 42 years. Most of the Section 8 stuff that you see around here from back in the day, I worked with the developers to get that done. But today, I'm here for a very important reason. Yes, it's Women's History Month, Women's Health Month, or whatever you want to call it. But more important, and I'm going to direct some of this to the men that are sitting here, because it's very important. We're here to talk to you about colorectal cancer. Colorectal cancer. How many of y'all like the barbecue food? Come on, raise your hand. Y'all know y'all like to get the stuff on that grill and everything. Okay. I like a good barbecue too. I used to love barbecue food. And the reason why I'm here is because we recognize that Barbecuing food can cause a problem. Now, why is this important? Columbia University is partnering with faith-based organizations in the neighborhoods, people who identify as African American, Black, Caribbean, because they noticed post-COVID that there were so many other things that were going on in the lives of these people in our neighborhoods' health. You know, people did not come into the doctors or whatever. They thought they had the flu. You know, they took their regular, whatever they took their regular, how that dealt thing. They drank the honey and they had the tea and the lemon or whatever. But it turned out to be COVID. And what happened? A lot of our members of our community passed away because of a lack of knowledge. And that's what we suffer from a lot, a lack of knowledge. So Columbia is partnering with people because they figure, okay, they didn't come into the hospital, they didn't go to see the doctor, but maybe they would go into the church and talk to the pastors or some of the members about what was going on with them. So the idea was to train up a group of people from each church that has specialties in certain things: mental health, cardiovascular, and what we're talking about today, colorectal cancer, where people would be able to come and get screened. Now, men, I'm not talking about colonoscopies per se, because I know y'all don't want to hear nothing about people going where nobody goes before, okay? I don't want to talk about that. Y'all like to have that, okay? I'm not talking about that. There's more than one way to get screened.
Right.
So the idea is that we're going to come to you, we'll be in our churches, we'll be in a different church, on 145th Street, we may be in the Salvation Army, we may be anywhere. We will put out tables, we will have information like this to talk to you about colorectal cancer. Now, why did I ask you about barbecue? We are cooking ourselves to death. We are cooking ourselves to death. Now, I'm going to tell you a little story. Me and my dad used to sit there, we would go barbecue, and we would have the blackest frankfurters with the mustard and the ketchup. You know, you have the ribs with the barbecue sauce and going on down your face and everything. The blackness is just all over the place. And this added, as far as I was concerned, it added to the flavor. What we didn't realize is that the way it was cooking muscle meat, red meats, and other meats, fast, at high temperatures, there's a whole, and I guess the doctor could probably tell you better than me, there's a whole chemical thing that happens. But the result of that is what gets on the meat is a carcinogen. So we're here, you know, you see those 55-gallon drums in the summertime, all the smoke is going up, and that's great. But you need to learn how to cook on those things. Because if you don't know how to cook properly, what we're eating can kill us. So what happened to me and my dad? My dad, he used to be a basketball player for the New York Rams. He was always healthy. They diagnosed him with colorectal cancer. He died. The next year, I was given a terminal diagnosis. They told me it had gone too far. They didn't want to operate. They said, okay, well, we'll give you, chemotherapy and we'll give you radiation because you got to take care of your daughter. My daughter just died from breast cancer, but you'll take care of your daughter. And you'll see what happens, but we're not promising you more than 12 months. That was more than 25 years ago.
The Lord.
I'm still here.
Amen.
God is good all the time, all the time. God is good. And I wasn't even saved at the time.
Wow.
Those people from New Mount Zion Baptist Church came to my hospital room and they prayed for me. People from Salem Methodist Church came to the hospital and prayed for me. I said, you have to pray all you want, I'm dead. God had a different plan because he wanted me to stand here today and beg you folks, listen, we have got to get serious because what we're doing is generational. We're teaching our children, we'll teach their children, how to cook this food. And we put it before them at the picnics, and at the Thanksgiving table, and everybody's eating. Grandma cooked it. Oh, she had her foot in it and all that. Yes, she had her foot in it. And we have our foot in the grave. So we have to learn a different way to eat. We have to learn a different way to cook, and we have to have some veggies. Now, I don't eat a lot of veggies. I'll get some better music if I have to. No veggies. But we have to learn how to balance what we're eating in order to keep our colon happy. Because right now, I don't have this part of my colon here, across here, and all the way down here, gone. Part of my intestines, gone. I've had to learn how to eat differently. I haven't had a quarter-pound burger in over 25 years. my heart be hurting, but I know I can't eat that. Can't have it, you gotta leave it alone. So what we're gonna be doing here today, we're gonna be talking to you and coaching you through a process by which you don't have to have a colonoscopy per se. You can have a DNA screening kit test that we talk about a FIT test. And what you can do is just take a sample of your elimination, you put it on a little slide, and you can send it in. They will then analyze it, and then they will then give it to your primary care physician if there's anything that needs to be done. So you don't necessarily have to go drink that nasty stuff, because that's the worst part about the colonoscopy, is drinking that stuff and running to the bathroom all night. Because you don't have to drink that stuff. You can just put the information in the kit and send it back. They will do the analysis and they will let you know. Because this is important. We have to make sure that we're not teaching our kids and our children's children how to continue to eat unhealthy methods, unhealthy food. So what's going to happen today, these two young ladies will be here, they're going to sign up. What we're going to ask you to do, you see this QR code on here? Everybody have one of these? Okay, there's a QR code on here. You can scan it. It will take some information, and then somebody will follow up with you from Columbia in order for you to then arrange for a colonoscopy or a FIT test or a DNA sampling test. Now, if you don't have insurance, that's okay. We got that taken care of. You can come, we have people who will work with you to get insurance, because they want everybody in our neighborhood that look like us to get this done. It's important, y'all. I can't stress how important it is to get this done. And I applaud Columbia and Dr. Olajide for coming in. He's very passionate. If he would have been here today, he'd have been crying, because he is very passionate about this. Because our people are dying for a lack of knowledge. So we're going to open the floor for some questions. How does Apollo develop? All of that stuff. There's a doctor here that I don't particularly. So she's here, she can answer all those questions about all that good stuff. But I'm just here to say to you, hit the QR code, the information will go into the system. In the meantime, these two ladies are right here. They'll be able to work with you today. Men, I'm going to say this again. You don't have to get on the table and do all that stuff. You don't have to do that unless they find something that comes out of the test from your kid, okay? So please, ma'am, please, sir, while we're here, just sign up. It don't take long. They will work with you, they will counsel you, and they will make sure that you understand that what you're doing can save your life or prolong your life forever and ever until it's time for you to go home when the Lord says. You understand what I'm saying? Yes, ma'am. You have a question? Somebody has a question? Yes, ma'am.
I would like to know, does colitis have anything to do with it?
Okay, hold that question, because I'm not a doctor. I don't think you can know. Okay. What we're going to do? What I'm going to do, I'm going to sit down and let y'all talk to a good doctor, all of them real deep questions, and we're going to then be ready to take your information, okay?
It's on now, okay. Yeah, I think I could just introduce myself. So, and folks know me anyway. I'm Dr. Jesse Fields, primary care physician here in the Harlem community. And I wanted to, I'm sorry, I thought we were starting at 12:30. I went over to my office. And, so I wanted to make some comments. So what we're talking about, colorectal cancer, is one of the important disparities among African Americans, and that, you know, it's more likely to occur in black men and women, and we have a higher rate of mortality from colorectal cancer than any other racial group. So I wanted to talk about also Black health, and in honor of Women's History Month, Black women's health in particular. So I would like to make those remarks, and then we can address the questions, and I'll try to answer the questions in terms of colitis. So colitis is inflammation in the colon. That's different from cancer, but certainly that kind of inflammation, if you have any problems, if there's bleeding, it can be an increased risk for colorectal cancer. So yes, they can be related, and you should have screenings. The colonoscopy, which is being offered, is the best screening test, particularly for people who are at higher risk as African Americans are. So I want to speak some about women's health and continuing to honor Black history and women's history, and working, really aiming to make history by addressing the health disparities and premature death of Black women and Black people. The disparities not only in colorectal cancer, but in cardiovascular disease, in heart disease, hypertension, stroke, diabetes, asthma, breast cancer, maternal morbidity and mortality, and all of which our people suffer from and die from at a disproportionate rate. And I'm really glad to see my good friend Janine, who introduced me to the Metropolitan College Black Maternal Health Initiative. I met her here at the National Action Network, and they've been doing a lot of work. I have a lot of literature about these issues and how to get screening and information. There's a lot available, so we can give some of these things out, I hope, and people can share them with others in our communities. So I'm a primary care physician, and every day I recognize the importance of the doctor-patient relationship, how important communication is between the patient and the doctor and the patient. It goes both ways. It's important for the doctor to be able to take good care of the patient and participate in improving their health, to really know about them and what they're experiencing, and for the patient to also have some knowledge and education and be able to share what their symptoms are with the doctor. So communication is just essential, because delays in diagnosis, not being screened, the doctor not knowing your risk factors, like your family history, is, things get missed. And I think that's part of the disparity that is in our community. So heart disease is the #1 cause of death for women, for all women, heart disease. So cardiovascular disease is very, very prevalent and is #1 in terms of death. Symptoms of heart attack include chest pain, shortness of breath. Women may also experience shortness of breath and other kinds of symptoms, not just chest pain, but nausea or vomiting. Next is stroke. Each year, stroke affects 55,000 more women than men. And it is common, unfortunately, among African American people and women. The symptoms of stroke you probably know: difficulty in speech, numbness or weakness of the arms or legs, and high blood pressure during pregnancy, called preeclampsia, increases the risk of stroke. And we'll talk more about maternal health during pregnancy. So cardiovascular disease, hypertension, stroke, diabetes. Diabetes, of course, occurs in all people, men and women, but it is more common among our communities. It's very common. It increases the risk of heart disease by 4 times in women. So women with diabetes are 4 times more likely to have heart disease. And diabetes is a cardiovascular condition. It affects the heart, the blood vessels, all parts of the body, the kidneys, the eyes, etc. So gestational diabetes can occur during pregnancy, and women who are diabetic and pregnant have to be very, very closely monitored and have special testing. So next, breast cancer. Breast cancer screening, like colorectal cancer screening, is very, very important for Black women. It's important for all women, but the disparities in breast cancer among Black women are high. So in the United States, Black women have the highest breast cancer mortality rate. And breast cancer in African American women is more often diagnosed at later stages. I know talking about all this can have an emotional impact. I work in mental health, and I'm very sensitive to that. So we're here, we're talking about some hard stuff, and we could, say the emotional impact. We're together. The reason that we're talking about it is so we can change it. So we are aware of these issues, and we can help our community to address these things. I think we could make a big difference. Medicine, the institution of medicine in and of itself, is not going to change these disparities. The people, the community, and myself as a physician and other physicians who are caring can partner with community and with patients, and we can really make a difference in our communities, as I think this project is trying to do. So, there's breast cancer incidence in women younger than 45 is higher among black women than among white women. So if there's a family history of breast cancer, your risk is increased. And it means that you should be getting regular mammograms. It's very important. One of the big issues that is really very profound and another tragic disparity that we have to address and change is that the United States of America is the most, and let me say this, in most industrialized countries over the last 30 years, the number of women dying in childbirth has steadily declined. It's decreased in most industrialized, wealthy, so-called wealthy, developed countries. But not in the United States. It's increased in the United States, and we know it's because of the disparity among black women, black pregnant women who die more often, 3 to 4 times more common for black pregnant women to die in childbirth than for white women. And due to the disproportionate rates of mortality, maternal mortality and maternal morbidity, it's 3 to 4 times higher in black women than in white women. So the U.S. healthcare system, though it has some of the most advanced treatments and technology and the highest levels of spending, we spend more money per capita on healthcare than most other countries, we have not decreased the rates of death during pregnancy for black women. And over I think that this is related to the ongoing issues of structural racism and systemic racism in our country, in the United States. The history of, for 250 years of enslavement of our people, and then 100 years of Jim Crow, and ongoing structural racism that continues in all kinds of ways that we talk about in these disparities today. So I think that's why, and also the issues of racism in medicine. So black women not being taken seriously, not being listened to, not being recognized that they're at higher risk, and the teams in the labor room, labor and delivery, not being ready to act immediately, to know that this person's at higher risk. When their blood pressure goes up or they start bleeding, there's been a lot of research and good work done, particularly by black women in medicine, to put together protocols to follow when there's a sign that there's an emergency happening. The woman is bleeding, or her blood pressure is high, or she's had complications. There are protocols that are supposed to be followed so it can be addressed right away. And I think in some hospitals, those protocols, perhaps under-resourced hospitals, hospitals in poor communities, they may not have those protocols. So we need to make sure that the hospitals we use are up to par, are doing what they're supposed to be doing, and there's also issues around bias against people of color, black women and other people of color, that have to be addressed, and that we should demand that we be respected. And so I think that, as I said, I have a lot of literature, and I think we can build partnerships. I've spoken with some really wonderful gynecologists, black women gynecologists. Keisha Gaither, who's at Montefiore in the Bronx, who's familiar with this organization, very supportive. She couldn't be here today because she has another event. She's working, doing a series with the College of Cardiology, black cardiologists who are working to address some of these issues for maternal health. So there's an opportunity, I think, that we have to seize right now to come together, work together, and get this message out to our churches, our communities, our meetings, to talk about these things. So I'm going to stop and take questions, and then we can go forward. Thank you.
Can I just make one comment? They just dropped the age by which you can have a colonoscopy, now 45?
Yes, that's right.
When I was diagnosed terminal, I was 45 years old, so I would not have had any chance of getting screening. My daughter died from breast cancer at 32. She was too young to have had a screening. But what I'm going to say to you, and I'm challenging you, you go back to your elected officials, you go back to anybody you have to. We're trying to get the age for mammograms lowered for women. They say, oh, the breast is too glandular. Well, I don't care. If somebody would have seen my daughter's breast at that time, she might still be alive today. So like Dr. Fields said, we have to start advocating for ourselves. Start with Columbia. Start making Columbia move. Okay, this is nice what they're doing, but we want more. We want more. And right now, they're only doing the African-American community. Well, some of us are African-American and Hispanic and Dominican all mixed together. We have to make sure that everybody has the opportunity to get screened. Everybody has the same opportunity to have optimal health as everybody else. So what I am, and I'm actually aggravating my cancer doctor, I'm going to keep pressing him. They have got to lower the age for mammographies for young women. Because he even said he was sick and tired of telling young women they're going to die from the breast cancer that they have because they were too young for mammography. So that's my challenge to y'all today.
Thank you.
So thank you all for sharing what you're sharing. I think it's important that we talk about these issues, but I think it's also important that we can talk about the root causes. Yes, good afternoon. Thank you for this important panel. I think what you all address is critical, right? But I think we also, as a people, need to understand that there are environmental issues that cause a lot of the problems that we're dealing with now. Black people are surrounded by industrial, companies and car, all kinds of things. We're dealing with the foods that we're getting, they're not healthy. We don't have the best options in our community. If you go to the average, in this area here, there's no real fresh foods that are offered. I tried to get something to eat that was healthy, and really I couldn't. Even in our homes in which we live, where, maybe the conditions are not so safe, maybe the water is not healthy, and even maybe the deodorant that we're using is not, it's not natural, it's not clean. So it starts from the products that we're using, the environment that we're living in, garbage outside. When people see that, it causes them to have stress. There's a whole bunch of things there's so many variables that can cause a lot of the issues that we're dealing with as a people, aside from the way that we eat. And so we have to attack them at the root cause of these issues, because if we don't, we're still going to continue to be bombarded by these issues. We have to be taking natural remedies, like even supplements, because when given the proper nutrients, the body can heal itself. So we need to be doing those things. And I guess my question is, how can we further educate our people about, the best sort of foods that we need to be eating, and maybe ways to sort of deal with these environmental concerns that we're dealing with every single day, so that we can address those bottom causes that we need to be dealing with, because we deserve to live in a healthy community. We deserve to have healthy foods. We deserve to be healthy people. So, thank you.
Yes, we agree. I think we have to work together. It's hard for people to do these things individually. Forming groups, lobbying, pressuring the stores to have healthy food, having campaigns where you petition the stores in the community. We're not shopping here if you're just going to sell us sugar. So working together, doing those kinds of things, people with diabetes coming together, figuring out where they can shop healthy, what's the healthiest food, what things can people use. I just think we have to organize as a community, and do this and spread the word. But I agree with you. So,
have anybody wrote a book, like a small book up because I heard that, like the sister over here was saying, from Salvation Army. You, huh?
Mount Zion.
Okay, I didn't, but, you know, I heard that the chicken, we do not even supposed to wash it. Like I used to, I got it from my mother, soak the chicken in vinegar or lemon, and like I used to work in Brooklyn at a hospital, and if I could walk into a grocery store like the lady was saying, the sister was saying, and I smelled the fruits, that's healthy. But how many people is running to Chinatown to get it, to get the fresh food? Go to Brooklyn where they have it in the Jewish community, because that's where I used to work, overnight at a hospital. And we don't have it in our neighborhoods. And I try to educate other people, but they want to do what they want to do and say what they want to say, that these supermarkets are good. I used to live in East Harlem of Wagner, and I knew even in 1985 when a young man as a Muslim brother was telling us things is going to change and you better wake up, because if you remember them watches that they had the date, the time, and the year on it, it changed. So now it is changing, that they are tracking us, and that's what they're doing, even with the phones.
Thank you, sister. I think her question was, is there a book that you are aware of or anyone is aware of that may have some guidelines about fresh eating and things of that sort?
Yes, there's material. There is, yes. I mean, I have some in my office. I didn't bring it today, but yes, there is. We can try and distribute that material. We can have that here. People can take it. Yes, we can work on that.
Yes, that would be very helpful. Thank you. Our next question.
Good afternoon, panel. Thank you for being here. Thank you to fellow Nan for giving us this. We need it. My question is around the breast screening, as we mentioned. Now, I understand that there's a 3D option for women who have a history of dense breast tissue.
Yes.
Do all women know that they can have that screening? Is that accessible to them? And I was going to say, just on a matter of having health insurance, that's another thing too, so that we all know that's how we access getting, better health.
So you're, in terms of the 3D, yes, it is better. It's more sensitive, and especially if you have dense breasts. My understanding, I've been trying to look at this, my understanding is that it is available.
Yeah.
3D is the standard. It's the standard, so it's what everybody's getting right now. And screenings should be covered. Most cults, certainly, if there's a higher risk of cancer, I think your doctor can fight if you're younger than like 35, and you have a family history of breast cancer, that's a higher risk. You should be able to make the case, your primary care doctor, that you need to have the mammogram because you're at higher risk with your insurance. They don't want to pay for it. Most screenings are covered, but there's always differences in different insurances. So you do have to be careful. Medicare, Medicaid covers colorectal screening. They cover mammograms. You might have an issue if you're younger, but so you have to work with your doctor. That's why doctor, nurse practitioner, whoever your primary care physician is. Many people don't have a primary care physician, and don't have insurance. There are not enough primary care. There's a shortage of primary care physicians in our community, certainly, and in general. So those are real issues.
Good afternoon, all, and thank you very much for this forum.
I would like to ask if a plant-based diet is sufficient for good health.
I think it can be a plant-based diet. The issue, I guess, you're concerned about whether you can get enough protein. You can mix to get essential amino acids. You can mix things like beans and rice. There's also tofu, soybean, which is a plant product, is high in protein. I'm a vegetarian. I mean, I eat chicken and fish, but I don't eat red meat. And I've been that way for a long time. So I think you can be healthy. You have to be careful. You might have to take vitamins. You can consult But I think you can, if you want to do that, you don't have to be healthy, you know. But if you want to, I think it's reasonable. I don't think it's impossible to do that. It's much healthier. Meat is really not very healthy. Protein and no fiber, very dense, doesn't help you in terms of moving things along in the intestine. It's not particularly healthy, red meat. So, I'm, keep going.
Thank you, Nancy. First of all, I want to thank you, Dr. Badger, for your introduction of this colorectal church trial. It's so needed, and colorectal cancer is so preventable. And thank you, Dr. Fields, for your commitment and service to Harlem. I have a simple, you're being recognized. Simple question. Tell everybody a little bit about polyps. The gastroenterologist is there to snare it, take it out.
Yeah.
Give them a little bit about the potentiality for cancer. How might that affect the next time you have to get a colonoscopy?
Right.
Educate them on polyps.
Thank you. Well, you're doing that, Dr. Boswell. We started with the education. So polyps, you can have, that's why the colonoscopy is a better screening test, because you can remove the polyp. Polyps can develop into cancer. So you want to remove them before they do that. If it's just a polyp, it can, but it can develop. So if a polyp is found, then you have to have a screening, another colonoscopy, which is now more than just a screening because you had colon polyps. That's a diagnosis. And then you can have another colonoscopy with 1 year if the polyp is large and looks like it is suspicious. 3 to 5 years if it doesn't look particularly suspicious, but you want to go back and see if new polyps have developed so they can be removed. Polyps they're important to find and to remove because they could turn into cancer. And as was said, the screening now is lower to age 45, and I think it's very important.
Thank you.
So yes, polyps are a diagnosis. They are an abnormality and should be removed. And then personally,
I'd just like to say that I'm a breast cancer survivor. They had one of those buses in front of my church, and that was extremely helpful. And they got in contact with my primary doctor. They wrote me a letter. They called me, to make sure that I made the contact. In addition to that, my sister from Atlanta came to help me when I was surviving from cancer, only to find out that she had cancer, but she wasn't going to be diagnosed, only since I was the first one. So it is extremely important. The thing is, all right, so we're learning what to look out for, right? And then we're going to say, okay, so we're learning also what to do about it. And the food is the biggest thing, I think, okay, so I'm moving towards a plant-based diet, right? And then I hear so many negative things about tofu.
yeah, well, there are some issues.
You know what I mean? So I think, and barbecue thing, I never knew that until today. And, so my point is that we need to spend a lot of time on educating ourselves on what to eat and how to eat what it is that we're eating.
Yes, absolutely. Yeah.
Any other questions? Oh, okay. I was going to say what the pilot, my girlfriend learned that hers get picked off in the summer, and they tell her she was cancer-free. She had pain in her stomach and went back in November, and they kept her in the hospital, and she passed, and I came from Colorado. On Wednesday, and her funeral was on Thursday, because the pilot ended up going into full-blown cancer. And my question was about, my mother had breast cancer. So my kids is in the 20s and early 30s. Is that too young for them to go and check for their breast?
20s is young. I think what could be done early on is for them to start doing self-breast exams and know how their breasts feel now in their 20s and to check every month. And the rule is 10 years before the relative was diagnosed. To start screening 10 years before your relative, first-degree relative, was diagnosed. That you should start your screening 10 years before they were diagnosed. So whatever age that turns out to be, they should start. They should be able to start screening at that age.
One more question. Eating once a day, is that bad?
What else?
Eating once a day.
Eating once a day. You know, I think you have to, these are every individual is unique.
I have no appetite.
You have no appetite. I think it's important to get medical advice that's based on your own unique situation, your lab test, your physical exam, how you're doing. You know, in general, it's usually recommended people eat more than once a day, but that doesn't mean, I mean, some people eat once a day. There's no strict, you eat once a day. So I can't say whether that's the right thing for you. You have to decide that, and hopefully you can consult with a medical provider, a doctor or a nurse, or a nurse practitioner. So,
Thank you.
if you want to add, sure.
Hi, I'm Paula. I'm one of the community health workers. It's very important to know the symptoms and educate yourselves on the symptoms of these different diseases. Because like for colorectal cancer, if you know the symptoms, bleeds up, you're seeing blood in your stool, you're having stomach pains every day. Know your family's history, whether or not you have had a history in your family of polyps and things of that nature. So it's important that we educate, not just knowing the symptoms, but talk to your family. Find out what's been going on in your family. Watch out for the symptoms. Learn the symptoms. It's very important and can be very helpful. This way, you can get your screenings done before it gets to the stage where you cannot be helped. You know what I mean? So if you do develop something, colorectal cancer or polyps, they can find them before you're at a difficult stage.
Thank you.
If your stool is dark, your stool is very dark, and if you have pains in your stomach, like it must have been about 2 months I was walking around, I just thought it was indigestion. I thought I had a stomach ache. I thought maybe I was eating stuff that I shouldn't have been eating, and I had these pains. I would go to the bathroom and I wasn't able to do anything. And this went on for 2 months, and then I started noticing that my stool was very dark, and then I started seeing blood in my stool. That's when I realized I needed to go see somebody. But see, it could have been too late for me. By the grace of God, it wasn't, but it could have been too late for me. So don't wait. And as far as my daughter was concerned, there's no history of breast cancer in my family. She gave birth to a child, and for some reason she thought that the reason why her breast was hard is because it was milk that was dried up in her breast. By the time I got there, I said, "Are you serious right now?" And I took her every place I could take her. I took her to the Ralph Bergen Cancer Center over there on Madison Avenue. And they did the best that they could do with her, but it was too late. So if you have girl children, and let me tell you something else, men, the president of North General Hospital died from breast cancer. Eugene McCabe, in the hospital, working there every day, died from breast cancer. So it's not just a woman thing anymore. It's a woman and man thing. So go home and talk to that while you fooling around with him doing whatever. Be checking that breast out of his too, okay? Because they're not going to believe it. Oh, it's not going to happen to me because I'm a man. Yes, it will. So if he's not going to do what you found, wait till you go to sleep. So what are you doing? I'm just looking, do what you have to do because these men are not going to believe it can't happen to them. But it can happen to them. Okay, one question.
Yeah, my question is, Columbia University and Columbia Hospital, you know who started that? Because what I'm upset about is, the sister just said about a man can have breast cancer. Now, when you first started to talk, you talked about statistics, and it was divided black and white. There's only men and women, the autonomy is the same, and the Bible teaches you how to eat, and the sister that Mrs. Haberga, just think it's somebody's pet. It's a cow. It's a living sexual creature that loves. You shouldn't eat meat because you have love, and God is love, and the world, what we talked about before, it's social, emotional, and physical. Physical is what we eat.
Okay, I'm sorry.
So
What's the question? What's your question?
who started Columbia, and the Bible teaches you about the diet. At the beginning, before there was refrigeration and ovens, it was a little more strict. You couldn't mix dairy with other living, moving things that you ate.
Okay, thank you.
I know that the topic is about colon cancer, but also I heard you mention about being a vegetarian, and I know that in some instances vitamin B12 is associated in terms of becoming insufficient and the vitamin B12. Can you give us a little information about that?
Well, I think I can speak loud enough. You can take B12 supplement. There's also yeast, and there's certain foods that do have B12. So that's not meat is not the only source of B12. If that was your question.
Well, actually, the importance of vitamin B12.
Oh, vitamin B12 is a very important vitamin. It can actually cause dementia and fatigue, neurologic problems if your vitamin B12 level is low. Sometimes, it's a good question, I'm sorry, I misunderstood. So, sometimes the B12 is not absorbed because it has to be absorbed in the stomach, the intestine. There are certain factors that have to be present, so it's not necessarily an easy absorption. Some people don't absorb B12 well, and they have to get B12 injections. So it has to be measured to be checked. Usually, if you get a checkup or a screening physical, if you're feeling tired or you have anemia, it can cause anemia as well as neurologic problems. You should be getting regular B12 injections. And often people will feel a lot better after getting the B12 injection. So it's an important thing to check. Thank you for the question.
Yeah, great question.
Assalamu alaikum. My name is Michael Shabazz, and being that we're on this medical topic, what I want to know, can you explain and give some information in relationship to high blood pressure and what are the signs of a possibility of getting a heart attack?
Sure, high blood pressure. So to know what your blood pressure is, you really have to measure it. Some of the signs of problems with the blood pressure, by the time you start having headaches or getting chest pain, a catastrophe is about to happen. So you don't want to wait until there are actual symptoms. You could be getting headache, but I think your blood pressure should be checked. We've done blood pressure screenings right here in this room, and we probably should do more in the community. But you can get a blood pressure monitor in the drugstore. Check your blood pressure at home. See what it is. 120 over 80 is normal, and it should always be less than 140 over 90. Hypertension is a very, very serious condition if it's not under control. It can cause heart attacks, strokes, kidney disease, other peripheral vascular disease as well. We should also mention cigarette smoking is one of the things that causes vascular disease. So if you have diabetes or high blood pressure and you smoke, then you're at very high risk of having a vascular or cardiovascular event. Hypertension also can affect the eyes, as well as diabetes can affect the eyes. So you want to check your blood pressure and see what it is. You don't want to wait for the symptoms, because the symptoms are you have a heart attack, you start getting chest pain, you're getting angina, you have coronary artery disease, you have kidney problems, or peripheral vascular disease. You're walking and you start getting pain in your legs after you walk a couple blocks, and you have to stop to rest, then the pain gets better. So it's an important issue. We could have an hour conversation about hypertension. It's so prevalent, it's so important, and it's unrecognized. You don't know you have it until, unless you take your blood pressure. Unless something bad happens and then you realize your blood pressure is elevated.
Well, what are the other acute signs that we need to look at in regard to that? Besides
Headaches, nosebleeds, chest pain, fatigue. Those are, but those are things that are pretty, when the blood pressure is really high and is causing problems.
I think just one thing that would help would be to visit your primary physician and get checked. Go to your scheduled visits and let them check your blood pressure. Also, Columbia University, you may have seen us in the community because we've been out there and we're doing blood pressure screenings everywhere we can be. We're at all of the parks and whatever event we can jump in and do blood pressure screenings, we're there. So look for us. We're under the umbrella of InTouch. You may have heard of us. And InTouch is a community health worker service that we just go all around the community, and we do plenty of blood pressure screenings, so please watch out for us.
Okay, before we move on to our next question, I just want to advise everyone that we do have 2 vendors back in the back. So if you just want to come back after the forum or during the forum and just see the vendors, and let's support these 2 ladies and what they're doing and what they're selling back here. All right? Next question.
Let me just answer this lady's question. Miss, you said your question wasn't answered. You said
Yes,
at the bottom.
do you know who started Columbia?
No.
I don't know who started Columbia University. I know Dr. Elijah Day Williams started this particular study. It was funded by Columbia, and he started this particular study because he had a personal interest in this particular study. But there's if you notice, and some of you seen this may want to do this, I must be part of maybe 5 different studies, and they pay you money to fill out forms or whatever, and I do all of that. A lot of the teaching hospitals now have these studies that are being done by the researchers in the hospital that are particularly trying to ascertain what is going on in the Black community concerning their health. So there's stuff out there, but I'm going to address your other question. Hello, Miss?
King
The other
George,
question, you said
King George II, King George III. He just told me King George II, I knew it was King George III. He put his crown to God to make the kingdom come. But digital blood pressure is not accurate. The AI is not accurate. And
Okay, we're going to move on to our next question.
Okay, I want to ask a question about breast cancer. Okay, I went to the clinic not too long ago and to have examination on my breast. Now, what they do now, they don't only give you, even the hospital I work in, Lincoln Hospital, they don't only give you one test. They give you a second one, but that second one is not covered by no insurance or whatnot. You have to pay out your pocket. Because they do that second one because the first one that they can't find anything, they go over with a second one.
Okay. All right, thank you for sharing that information. Thank you. And before we continue on, I just want to piggyback on what you had mentioned about the importance of listening to your body. Last year, when I had my annual physical, I was telling the doctor that I wasn't my stomach wasn't right. Now, I thought it was because I had gone to Bali and I had eaten some foods I had never eaten before, so I was attributing it to that. So he sent me to a gastrologist, and the gastrologist immediately ordered the colonoscopy along with an endoscopy. And they found that I had a severe stomach infection, and I did have polyps on my colon. So I want to piggyback on that. It is very, very important to make sure that you listen to your body. And also what they found, which was very surprising to me, in the physical, was I suffer with hypertension. So I go to the doctor every quarter. I have a one visit that I go. They found in an EKG that I had a left binary blockage, which was caused by a heart attack. So somewhere within 2023, I had a mild heart attack and I didn't even know it. So it's very, very important. I encourage everyone, men and women, get your annual physical. And if your body is saying something to you, listen and get it checked. All right? Get it checked.
As Ms. Sharpton has said, that we must fill out, like she said we was gonna fill out a form stating that what we have, like I suffer with asthma, shortness of breath, I have diabetes, I have high blood pressure, continues. I'm in regular heart. So I have to be careful when I'm walking fast. And we must fill out a form that Ms. Sharp said. We must have a form that should be filled out while we are here at the House of Justice, so they'll know what's wrong, what we have, you know?
Medical information, very important, very important. Okay, we're gonna take one more question and we're gonna wrap it up. Yes.
Thanks so much. So I wanted to just kind of piggyback off of my question earlier, because I was thinking about, you know, every single day we're bombarded with free radicals in the air, right? You know, it's not, the foods that we're eating right now, they don't have the nutrients that we need every single day. What I do is I take supplements. As a doctor, do you recommend that folks take supplements? Because what I'm finding is that through the supplements that I take, it actually helps me to build my immune system and sort of combat a lot of these free radicals that are roaming in the air due to, you know, the air pollution and other, you know, people smoking, all kinds of like air pollution in the air that's attacking our bodies. So what do you all suggest that people do to help with sort of combating the, you know, what we're bombarded with every day?
Can I have one person?
Is it quite?
Yeah, it's gonna be real quick. Why the doctor giving me high blood pressure if I don't have high blood pressure? They say it's gonna prevent me from getting high blood pressure. But when I stopped taking the pill, the pressure go up. But I never had high blood pressure before. I was a borderline of diabetes. And why they giving me blood pressure? Should I still take it or not?
Well, I think you would have to ask the doctor that question. That's an issue of communication with the doctor. So you can check your blood pressure and see if it's really normal. Maybe they're giving you, if you have, so I don't know. I mean, the doctor has to, and that's a question for the doctor. So, you know, you have to really communicate with the doctor. You can check your blood pressure and see what it is and check it many times. You know, in the morning, in the evening, different days. And your blood pressure is like, what's your blood pressure? Normal, 110 over 80, 120 over 80.
What is it?
What is it?
128 or 115.
Over what?
Over what?
Over what?
82.
Over 80, 115 over 80 is normal. So you have to ask your doctor why they're giving you blood pressure medication. If it's not. I mean, you should be able to communicate. That's important. You should be able to ask your doctor questions. I mean, that's the basic thing. Antioxidants, I think, are a good idea. You know, everybody's different, so you have to figure out what works for you and which ones. But in general, yes, I think it's a good idea.
Thank you.
Okay, my last comment is, men, this is my comment for the men. I want to see you grabbing this and filling and hitting that QR code, men. Then I want you to go and find your friends that are men, okay? And I want you to tell them, come here, come to Columbia. I want you guys to go out there and be the foot soldiers for your brothers because you need this men. I'm speaking directly to y'all, okay? Can I get an amen to my men that you're going to go out and do this for me?
Amen.
Amen.
So before we leave, I brought lots of literature about mammogram screenings in New York City that are available, and also issues of resources for housing, for health, for nutrition, and a booklet on maternal health and the increased risk for Black women in terms of maternal issues,
Excuse me.
maternal health.
You never answered your sister's question.
I did. She asked about antioxidants. She asked about supplements. I said I thought you have to go individually, but I think it's generally a good idea to look into whether you need supplements if you find them helpful. There are all kinds of different supplements, so it has to be on an individual basis, I think. But in general, I call them antioxidants, you know. And they're also, you can also get that help from different foods as well.
Question, I have a question. How does a man tell if he has breast cancer? What do you check on? The breast lumps in the...
In men, breast cancer is usually detected by feeling a lump in the breast, and then they have a mammogram and a biopsy to see. If you feel something abnormal, you know, it's important to examine, as the sister was saying, to examine your chest, and if you feel something, it should be evaluated.
How often does that happen to men?
It's less often than with women. It's a lot less, but it does happen. And it is important to have regular checkups so that if there's something there, it can be detected.
Well, she mentioned a doctor that died from breast cancer.
Yes, we met at North General Hospital. Yes, we met there, and I knew
And a
the
doctor.
president of North General. He died of breast cancer, yes. He did. He died of breast cancer.
Taking care of others, he neglected to
Right,
take care of
and,
himself.
you know, men
That's
don't
usually the
expect that they're
case.
gonna have, they may feel something, they don't think of breast cancer. But it is.
Was that something special that a doctor didn't recognize what was wrong?
Doctors in general don't particularly take good care of their health necessarily, just because they're doctors. They're focused, they're.
My father got At least you're honest.
Okay, so before we wrap up, I'm going to ask everyone here, first I'm going to tell you a little bit more about this study. The study lasts for 1 year. In that 1 year, they ask you to come over to the Community Health Center office, which is on 130th and Broadway, and they'll give you that information if you participate. It's on 130th Street and Broadway. They want you to come 4 times over the year if you're eligible to participate. So the first thing is to see if you're eligible to participate, right? So you would do this QR code, scan the QR code. If you guys could do that now. If not, if you have difficulty using your phone and QR code, I'll assist you in taking your information. And it's just like 4 or 5 questions that they ask you. Okay, now as an incentive for participating in this study, they'll give you a $50 gift card each time you meet with them. So that means $50 times 4. Plus, when you go there as an incentive, they'll give you, traveling for MetroCard for travel. So that's just an incentive for participating. Because the purpose of this is to get our people screened. We are sick and tired of our people suffering from these different diseases that are preventable. So you're going to see more and more of these types of screenings. Like recently we did a mental health screening. For 2 years we did it. We went all around the community screening people for mental health and offering them free counseling. And that's still going on. So you're going to see Columbia members, community health members, such as myself, going around screening for mental health as well.
What about Alzheimer's? That's a big thing in Alzheimer's.
It is. It is.
And it seems like very little is being done.
They ask us as health workers what the community is saying and asking for, and I'll bring that to the table, and that's a good one. Yeah.
Yes, I also have been doing workshops with people, families, and people living with dementia around helping people to be engaged, to still be involved, even though they may not be oriented or fully, cognizant of what's happening, but they still can. It's important that they still be spoken to, that they be engaged and involved. And so we're working on this. It's called The Joy of Dementia. You got to be kidding. Very provocative. We don't have a cure. There's a lot of people in our community. It is disproportionate in the Black community. So what are we going to do with our loved ones right now who have dementia? We need to care for them and involve and not isolate them and not shut them down and put them away someplace. And we need to keep they're still living. They're still human beings. They need to be loved and cared for and engaged and involved. They don't want to be separated. I see many patients and families with dementia, and they always want to be included. You talk to the relative, they say, "What about me?" Even though
need to advocate for a cure.
well, they're working on a cure. They're not. There's how many people have dementia right now? What are you going to wait for a cure? Okay, we are not immortal. The human body does not live forever. There's not going to be a cure that makes us immortal and our bodies don't decline as we get older. That happens. There's a normal aging process where people don't remember as well. These things are part of life. There's not going to be a pill that's going to make you invincible and you live forever. I think that's... Well, you can wait for a cure. I'm interested in helping the people who have dementia right now. I'm not waiting for a cure. There's a lot that can be done. We need a cure, but, you know, we need a cure for a lot of things.
Right. Okay, so moving on, for those of you who are interested in participating or see if you're eligible to participate, please see me in the back. I'd just like to get your name, telephone number, and email address. And I can assist you if you haven't already. Scan the QR code and put in your information. I still would like to get your name and telephone number or email. Okay, you can meet me in the back. One of us, any one of us.
COVID, people still get COVID. People are still getting, we don't have a cure. We have a treatment, we don't have a cure.
Thank you so much. Thank you so much. So
I'm sorry, I'm not against cures. I'm not against cures, but I think we have to deal with the reality right now. Screening is very important. If we get screening, we can detect things earlier and it can be treated.
Right, right. Go to your elected officials and start demanding the same thing that they give to people downtown, you want uptown. That's what you have to do. Al Sharpton is very good at getting things changed, okay? We are suffering from dementia. There's no cure today, but if enough people make enough noise and vote, that becomes the issue. When you start voting, people start paying attention to you. When you start voting, that's when you exercise your power. See, we are so complacent to just sit down, whoever's going to be in charge. No, you want stuff now. The time for sitting back and relaxing is over. Gotta get radical. Go to vote. That's when people pay attention to you.
Amen.
thank you so much. So this is what our House of Justice family, this is what I need you to do. We've had an amazing panelist up here today. We want to say thank you. Y'all can stand on your feet. We want to say thank you to Dr. Badger. We want to say thank you to Dr. Fields. We want to say thank you to Paula Stevenson and to Michelle Frank. Come on, put your hands together. What a wonderful, wonderful forum. And right before we close out, I just want to give you some words. So as you know, the Women Auxiliary is sponsoring these seminars every Saturday after the rally. Everyone can have a seat. I just want to give you some information and we're going to let you go because we have another event in a few moments. However, the Women Auxiliary is sponsoring these seminars throughout the month of March. So last week was mental health. Today was our medical panel. Next week, we will be talking about domestic violence. And to talk about that is none other than our advocate in the community, Stephanie McGraw. She leads, she's from WARM, which stands for We All Really Matter. So it is definitely an important topic. Again, next week, we invite you to join us. And each week, the Women Auxiliary, we encourage everyone just to be in unison with colors. So next week's color will be orange. And our host is none other than Miss Nancy Darlene Crawford. So we welcome you to come to our rally at 9 a.m. We would love for you to be there. And then on the 23rd, we will be doing a healing forum, and her name is Malika Thomas. So we invite you to be a part of that. And of course, on the 30th is our Women of Excellence here. And if you're interested in tickets, you can see our chairwoman or our president, Kathy Jordan Sharpton, or our president, Lisa, about those tickets on the 30th. All hearts and minds are clear. We cannot thank you ladies enough for your amazing information, educating our community. Thank you so much. Support our sisters in the back. Remember, a plug, our national convention is free. You can get registered at nationalactionnetwork.net. We're going to have panels like this. We would love for you guys to be a part of it and come and let the community know who you are. We cannot thank you enough. And again, on behalf of our chairwoman, Kathy Jordan Sharpton, and President Lisa Goldie Hart, we thank you and we encourage you. And we'll see you on Saturday. Everyone, God bless and get home safely. Thank you so much.